From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about childhood obesity and prevention strategies for families. Our guest today is a board-certified pediatrician in Venice, Dr. Susan Mim. Dr. Mim, thank you so much for being with us.
My pleasure to be here.
News stories often focus on the rise in obesity in the United States. Are we also seeing that rise in obesity in children?
Yes. Obesity is a complex, common, and chronic medical problem with significant health and social consequences. And in adults, we are definitely seeing a rise, which is significant, but we're also seeing a rise in the pediatric population. Obesity in 1965 was approximately 5%. In 2018, 19%, which is a threefold increase in obesity. The 1 in 7 children are affected by obesity, and over 14 million children have obesity, which makes it our most common chronic pediatric disease.
New guidelines on childhood obesity were released by the American Academy of Pediatrics. Can you talk about what's new?
Earlier this year, the American Academy of Pediatrics published an updated pediatric guidelines for obesity. The most recent prior to that was 2016. And I think the most important part is the research and all of the experience that went in over the last decade, as well as treatment options and plans, as well as identifying that this is a chronic disease and treating it like a chronic disease. We have practice guidelines for asthma, diabetes, and that's what this is meant to help pediatricians as well as specialists that help our families manage or deal with obesity.
What's significant when you talk to parents, the fact that new guidelines were released, why is that significant?
I think the significance is for hope, for treatment options for our families, and I think identifying that this is a multifactorial disease and that it takes different approaches. There's not a one-size-fits-all. It's not a quick fix. And so it helps, practice guidelines help us help the patient in the most significant way.
What indicates a child is actually obese versus perhaps just slightly overweight or carrying a little extra fat as they're waiting for their growth spurt, et cetera? Sure.
So we use measures to assess that, and that's the BMI or body mass index, as most people have, I'm sure, heard the term used. It's a measure of your weight and relative to your height. The difference with pediatrics is we don't use just the number, the BMI number. We use the BMI as a percentile. Children are growing and changing all the time, and so at different ages or developmental levels, a particular BMI may have a different percentile. And we recognize 5th to the 85th percentile for a patient's age and sex to be in the normal range. Underweight would be less than 5th percentile. Overweight would be 85th to 95th percentile, and obese we classify as greater than 95th percentile. And then severe obesity would be even greater than that, 120% of the 95th percentile. The BMI can be affected by other factors such as maybe a shorter stature child that is muscular, or maybe an athletic muscular teen. So those can be taken into account by the healthcare provider.
So it's really important to have these conversations with the healthcare provider because it's much more than just that number.
Correct. And it's also, we plot these on growth charts or percentile charts, and we watch these over time because a child is growing and developing. So we're looking to see, are we maintaining, are there trends that we can address, and have that discussion of just a healthy lifestyle and the prevention of a chronic disease, just like we do other diseases.
At what age are numbers like BMI being monitored?
So we monitor health and weight and length in our infants and look at proportions. But we start assessing the BMI percentiles at age 2, and these are followed all the way through adolescent. Well, it is multifactorial. We know genetics, lifestyle. There are things that affect our energy in or energy out. It could be not enough activity. It could be a quality of nutrition or access to quality nutrition. We know that there are health discrepancies or inequalities in populations that affect chronic diseases, and that includes childhood obesity. So there's multiple factors that go into it.
What is the most concerning thing about childhood obesity? Like, what are some of the major health consequences of childhood obesity?
Right. So childhood obesity, I would say one of the risk factors that are most important is the risk of ongoing obesity into adulthood and being an obese adult. That being said, the chronic health concerns are hypertension, heart disease, elevated cholesterol and lipids. Patients with obesity can have sleep difficulties or sleep apnea, joint difficulties, knee pain, back pain, that then limit further activity, which increase the risk of obesity. Other things for our teenage adolescent females can be irregular menstrual cycles. And I think in our developing children and adolescent is the social and emotional impact that it can play as with bullying or depression, self-esteem. So it really affects the whole child.
What do parents need to know to help prevent childhood obesity before it even becomes a problem?
So I think prevention with, as a parent, with your pediatrician or your pediatric healthcare provider is important to focus on a healthy lifestyle. And in our busy, active culture and lifestyles, it's important to take time for some of those things that really improve our quality of life. Things like, and you can start at a young age, things like healthy sleep, sleep routine, avoiding cups and bottles at bedtime, removing TVs from bedrooms. So we know those can all be risk factors for poor sleep, and poor sleep habits is a risk factor for obesity. Other things, screen time. So screen time is, I think, very difficult for parents these days to manage with their kids. Oftentimes, our adolescents, their education is on the computer, but they're also spending a lot of screen time while they're doing that, maybe being inefficient or texting or doing social media at the same time. Separating those two things out. Creating maybe screen-free zones in your house, maybe the kitchen or in the dining room table. And also by modeling, put our phones away and pay attention to our kids. I think that those are all good things. Activity, we have to energy in, energy out. So the more active we are, there's lots of health benefits, including maintaining a healthy weight. Children should have at least 1 hour of activity per day. And that doesn't have to be sports or just PE at school. It can be going for a walk with the family or the dog. We have beaches close by. Go for a walk on the beach. Throw a ball, kick a ball, go to the park, ride a bike, swim, dance. So anything that is movement is really important. And engage with your child. Those are opportunities to spend quality time with your child. Have fun. And I think when we turn off our electronics or we engage with the children, we benefit immensely too. This is, adults struggle with all of these factors. And if we do it as a family, we all benefit.
Yeah, how often do parents try to implement healthy strategies for their children and it ultimately impacts their health as well?
Our children can teach us a lot.
If they are concerned, and maybe their pediatrician hasn't brought it up to them yet, but parents might look at their children and say, I'm concerned about their habits or I'm concerned they're gaining weight. How can they discuss that appropriately with their healthcare provider?
So I think it's important, one, to have regular well child visits, and that's the perfect time that we as healthcare providers have the opportunity or take the opportunity to discuss, their BMI percentage, their trend. Are they staying at their percentiles? Are they crossing percentiles? Are there habits that we need to alter or encourage? And I think it is very important to do it in a positive way. Our goal is a healthy lifestyle. And so if there's ways that we can identify risks in their lifestyle, or they can identify risks or ways to implement changes in their lifestyle. Nutrition is, we talked about some of the, sleep and exercise, but, speaking with your physician or healthcare provider about what is healthy nutrition for your child, what is the portion size that they should be doing, how do we do variety, and they may help you assess and implement healthy suggestions, such as, when you get home from the grocery store, chopping up fruits and vegetables, having it easy access in the fridge. For snacks, have your children go to the refrigerator instead of the pantry. Have a bowl of fruit out. The children should have 3 meals a day and 2 snacks, and look at portions, plate size. We tend to go out to eat a lot, or we do order a salad and maybe share an entree, take half home. So there's ways that you with your physician can look at your overall lifestyle and see if there's small changes. This is a chronic process. Little changes make big differences in the long run. And by changes we make, our children see that. It should not be punishment. Food should not be reward. Let's use food as nutrition and fun and health. Get the kids in there with you. See how many colors of the rainbow they have on their plate. Let them measure. Let them, stir, mix, chop. I think I really encourage families to get the kids in the kitchen with them. Let it be a family endeavor, just like you go out and play together or do other things together. Get in the kitchen together.
As a pediatrician who treats kids of every age at every stage, how do you address this with families? Because weight is such a sensitive topic. How do you address with parents when you're noticing that those BMI trends or anything else are concerning?
That discussion is easiest when you have a rapport with that family, when you've been seeing that family over multiple years. And it's an easier discussion when I see that child maybe going from the 50th percentile to 75th to 80th. And I show them the growth chart and I say, this trend can be concerning. What are we doing? Is there something we can do different? And then also our adolescents or our children, they already know. Their peers are either, overweight can be a stigma, they've been bullied. So just having a safe place to have this discussion, I think, is very important. And to just have the discussion at the point where they're already obese is difficult. So it is difficult. And the families have to realize that this is a chronic problem. It is multifactorial. It is not shameful. It is not anything that personally they are wrong. We just want to help them be their healthiest selves. And so it's teamwork. So I think approaching it from that standpoint.
Recognizing again that this topic can be a very difficult one to have a conversation surrounding, how do you help parents navigate weight and diet conversations with their children who may be facing, like you said, bullying or other issues?
So I try not to use the word diet with kids, and I try not to use weight as a number. What I focus on is healthy lifestyle. If they work on energy in, energy out, I tell them their body will take care of it, the rest. Let us monitor the percents, but you just work on healthy lifestyle. And I think that approach with little increments. Have them go for a walk. Can they meet their friends at the gym? What works for them? Because I can give them all the things to do, but they have to figure out what works for them, because ultimately they're the ones that are doing this. So I think empowering them, and a lot of children, if they're still growing, they don't need to lose weight. They're continuing to get taller. All we want to do is tweak their habits to maybe a little more health, a little more quality nutrition, maybe a little more exercise, energy output, that then they can see that percentile coming back on the chart. And they're not worried about a number so much. And I think that I try to focus on positive, healthy lifestyle and not so much picking a number.
So focusing on that positive, healthy lifestyle, perhaps if parents listening to this or watching this say, we've already implemented some bad habits, or I know my child is already overweight or on track to be overweight, how do you encourage parents or help families teach their children the importance of that healthy lifestyle without maybe overwhelming them, the parents, or overwhelming the children?
I think modeling good behavior is very important. And so, plan family outings, plan to leave phones at home. I mean, I think identifying the risk factors. And then if it's to the point where this is a medical problem, and I understanding that, then that's when maybe they, reach out to their pediatrician, or maybe we do the next level. Maybe we have them meet with a nutritionist, or maybe we have them, join a fitness program or things like that. We just try to meet the families and the patient, the child, where they're at, if they're ready for change, and help them make those changes. Again, this is not easy. If we wouldn't be having this epidemic if it was easy or there was a quick fix. So I think empowering, and it doesn't have to be results in 2 days. We're looking at long-term improvement in emotional, physical, cardiac health. We're looking for our goals are long-term. That teenager doesn't have, the ability to understand that I'm avoiding heart disease at this point. We want them to feel good. And so I think those are goals. And I think if they make real small changes, really positive reinforcement for those, and being patient with results, I think that's the most important thing.
So you mentioned earlier when we were discussing the new guidelines that it's not a one-size-fits-all approach for treatment. If parents have tried implementing healthier habits and there's still a weight issue for their children, what does treatment look like? Because it's not just immediately medication or surgical like
Correct.
It might be for adults.
Correct. So what we have is something called intensive health behavior and lifestyle treatment. And they are programs set up to help that family or adolescent that's ready for that next stage. It feels like they can't do it themselves. They're ready to take the next step, and they need a multi-team approach. And oftentimes that's done with a nutritionist, your meal planning, someone's helping follow their results to help give them feedback, as well as emotional, oftentimes support, therapy, things like that. Because there's a lot of things that go into increase energy in, increase energy out. Look at eliminating medical problems that could be contributing, such as maybe thyroid issues. So at least screening for some of those. But as a primary pediatrician, I'm going to help that family get the resources to take that next step, because it is an important step for some families. And right now, those are our tools. If that does not succeed and we have medical problems that are already starting to show up, such as prediabetes, elevated lipids, then there are now FDA-approved medications that are starting to come down the pipeline that we're starting to use in adolescents, as well as there are approved surgeries for some of our adolescents that have truly failed the first level treatments and are significantly overweight and wanting to change that.
What would you say is your key takeaway for parents and families when it comes to childhood obesity and even the new guidelines that have been released?
I think model good behavior. We can always all strive as parents and children to be healthier selves. And I think the opportunity that parents have when their children are younger to engage them and teach them life skills that they will have. So if we value healthy lifestyle and getting in the kitchen and working on meals as a family, then they'll continue to value those. Playing with your kids, what a great opportunity to spend quality time with your kids. You can't go back and get that. And think of the long-term life benefits for yourself and your children. So enjoy your kids. It's challenging in today's society, but keep it simple.
Dr. Mim, thank you so much for joining us today and talking about the new guidelines and a lot of parent questions, answering those. We appreciate it. And as always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.